Good evening, everyone. We're a team of social innovators who have the necessary skills across engineering, medicine, and entrepreneurship to reduce preventable deaths by ventilator scarcity in resource-limited healthcare settings. What united us was our passion to help address this need. Our team has either experienced this pressing issue firsthand in Pakistan or worked in similar resource-limited settings across the world. I want to start by telling you a story. I want all of you now to imagine yourself walking into a tertiary care hospital in a low resource setting where you see 50 beds lined up and only 2 nurses, and you're given this. You're asked to manually ventilate your child using this until they can find him a ventilator. This is what I experienced firsthand when I took turns manually ventilating my friend's 2-year-old son Bilal for 3 days and 3 nights. Unfortunately, it wasn't enough. His lungs ruptured and he passed away. Bilal's case is not unique. In fact, respiratory disease is the 3rd leading cause of death in most developing countries. Yet, healthcare spending is less than 3% of GDP, and this leads to an extreme shortage of life-saving equipment like ventilators. One of these countries is Pakistan, where there are less than 2,000 ventilators for a population of 207 million people. According to international standards, this amounts to a chronic shortfall of 24,000 ventilators, and we expect this number to double in the next 5 years. There are only 2 solutions that are currently available to patients, and neither is working for them. An ambu bag is not suitable for long-term use for 2 reasons. One, you need a nurse or a staff member to be there who can constantly ventilate the patient, and there is no control over the pressure or the volume delivered through an ambu bag. On the other end, a ventilator is extremely expensive and due to a high barrier of training, difficult to operate. And furthermore, since these devices have a high maintenance cost, dysfunctional ventilators are never repaired and cannot be used to keep patients alive. To address this problem, we have built a low-cost, accurate, and portable device that can deliver consistent air and oxygen to the patient. Now, from the very beginning, our efforts have been grounded in the principles of user-centered design. When we spoke to Pakistani doctors and hospital administrators, they stressed that our device be 4 things. 1, easy to use, capable of remote monitoring, portable, and built using locally sourced material. All of these considerations have informed the development of our MVP. We are currently testing this device head-to-head against a traditional ventilator at Brigham and Women's Hospital. Preliminary results show that our device delivers ventilation within the acceptable range and with significantly far more accuracy than an ambu bag. We believe that our competitive advantage lies in the fact that we balance the portability and affordability of an ambu bag with the consistency and the accuracy of a ventilator. Doctors in Pakistan estimate that 90% of the patient coming in only need 4 of the core functions of a traditional $15,000 ventilator. Our device provides those 4 functions for only $2,000. We reached out to 30 key opinion leaders in Pakistan to survey demand and unit price for this device. Hospitals on average are willing to pay between $2,000 and $5,000 for this device. The cost to build this device is only $500, given that 90% of the materials are locally available. As a result, we envision selling about 25,000 units cumulatively over the course of 5 years. We believe you're well set for launch in Pakistan, given a few enablers as being first to market and a lack of direct competitors. To launch a new device in Pakistan, the Drug Regulatory Authority there have confirmed to us that we need to get approval from a foreign body like the FDA. As such, we have initiated conversations with a regulatory consultant who have told us that though FDA is a cumbersome process, we qualify for a Class 2 510K. And what that means is that we have an expedited approval process that will take no more than 6 months. We plan to first pilot this device in Pakistan. And in Pakistan, in the public sector, the Provincial Secretary of Health is the key decision maker at the macro level and influences much of the decisions that are made by individual hospitals at the micro level. Similarly, decisions made by private hospitals are dictated by relationships at the management level. We plan to leverage these relationships that we've been cultivating for the past year to sell our device through direct sales. To give you an example, when we first presented to the Provincial Secretary of Health, who's in charge of Punjab, which has 50% of Pakistan's population, he was ready to deploy this device across all the hospitals in his province. To give you another example, when we talked to the medical officer at Children's Hospital, they desperately reiterated that 100 to 150 patients need this device every single day at their hospital. Pakistan, however, is by no means the only market for this device. There's a need for this device in developing countries across the world, from South Asia to Africa to Latin America. And we envision the full market potential to be $10 billion, and we hope and expect to save 2 million lives globally. Now I want you all to imagine a future 1 year from now where a child like Bilal is rushed to the hospital due to respiratory distress and needs immediate ventilation. With Umbulizer, he's given the proper ventilation he needs at the right time, and he survives. This is the vision my team and I are working towards. And we want to thank you for your time and look forward to your questions.